Can you give other examples of things in the past that we now all understand quite well that's more harmful than it is helpful? And then the question, I guess, following that would be, why do we have this tendency to ignore those hints that something might be harmful?
Well, I often use bloodletting as a classic example because it was the mainstay of treatment for just about everything by doctors. It was pretty much all they had. And it was only, for 2,000 years. And it was only really displaced when they could use something else, when other things came along, but also when evidence showed that it didn't work. But it was difficult for doctors to accept that because they believed that it worked. Because whenever they did bloodletting, or most of the time when they did bloodletting for people with pneumonia or what may have been influenza or other ailments, people generally got better. And so they made the human error of not being scientific and assuming that because people got better after they did something to them, they got better because they did something to them. And so they attributed any improvement they saw to bloodletting, and they attributed any failure to not doing the bloodletting correctly. And so it became actually a pseudoscience within itself, and there were discussions about how much blood you should let, whether you should do it, what technique you should use, whether you should do a large amount or lots of small amounts over a longer period, how soon you should do it. And there was all these sort of comparative effectiveness studies without anybody ever asking whether it worked or not, because everybody just believed it worked because that's what they were told and that's what they saw. So based on their own observation rather than based on experimentation. And the same thing happens in surgery today. And a lot of what we do is probably not effective. And when you look at all of the...
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.